Hey there, and welcome to this explainer. Noticing unexpected changes in your own body, especially when we're talking about sexual function, man, it can feel deeply overwhelming. It's stressful. But I want you to just take a deep breath with me for a second. Today, we're going to step into a calm, modern medical mindset and look at this totally objectively. Clear, evidence-based medical information, that is absolutely your best tool right now. So let's take a really clear, structured look at exactly what's happening inside the body, completely free of any judgment or stigma. So let's just dive right into it. Are you, or maybe someone you really care about, dealing with painful erections, or maybe a noticeable bending that's just causing a ton of anxiety in your everyday life? If you are, I really want to validate exactly what you're going through right now. It is incredibly common to feel completely isolated when experiencing these symptoms. So many men just suffer in silence, right? They assume they're the only ones dealing with this, or they get terrified that it might be a sign of something much, much worse. But as you're about to see, the medical reality is actually very different. What's truly surprising here is the sheer scale of this condition. Get this, according to specialists at Yale Medicine, roughly 1 in 11 men will be affected by this. 1 in 11. That is a massive portion of the population. So the absolute first and most important thing you need to know is that this is a highly common, entirely non-cancerous medical condition. It's a structural issue, plain and simple. If you're dealing with this, you are absolutely not alone. You're literally one of millions of men experiencing a very well-documented physical change. Now, because of the stigma and the silence surrounding it, the psychological impact is profound. Research actually shows that about 50% of men dealing with this experience some level of depression. And it makes sense, right? It can affect your physical appearance, your sexual function, and your relationships, which naturally takes a really heavy toll on your mental well-being. Honestly, just acknowledging that emotional weight is a crucial first step in the healing process. So the most crucial point I want you to take away right from the start is this. This condition is highly treatable. It's a completely normal, routine topic to discuss with a doctor, especially a urologist. In modern clinics all around the world, doctors are seeing and treating this every single day. There is absolutely no need to just endure the physical pain or the psychological distress in silence when there's literally a whole spectrum of effective medical care waiting for you. All right, Section 1, Symptoms and Underlying Causes. Let's take a look at what's actually happening inside. The official medical term for this condition is Peyronie's disease. Simply put, it's a condition where scar tissue develops inside the penis, which then causes a curved and often painful erection. According to experts at places like the Cleveland Clinic and UT Southwestern, a mild kind of achy pain during an erection is very often the first symptom men notice, way before any significant curvature actually even begins. So you might be wondering, where exactly does this scar tissue come from? Well, it's usually triggered by minor micro-injuries. We're talking about tiny, tiny instances of microbleeding and inflammation caused by just a bump during sex, or maybe an injury to the groin during sports, like surfing. The fascinating and, definitely frustrating part is that the injury itself isn't necessarily some dramatic event. Most of the time, men don't even remember the specific bump or injury that started the whole process. Over the course of a couple of weeks or maybe months, that initial, totally unnoticed inflammation leads to the buildup of something called plaque. Now, in this context, plaque is really just a medical term for rigid scar tissue that forms inside the shaft of the penis. And because scar tissue is super inflexible, it doesn't stretch out like normal, healthy tissue does during an erection. That restriction, that is exactly what causes the penis to bend, curve, or even shorten. To really help destigmatize this, it actually helps to compare it to another super common condition, Dupuytren's contracture. Have you heard of it? It's a condition where scar tissue forms in the hand, causing the fingers to curve inward. Well, Peyronie's disease operates on the exact same biological principle. They are both essentially just scar tissue diseases that restrict normal tissue expansion. Looking at it this way completely removes the mystery. It's really just your body's localized inflammatory response creating a little bit too much scar tissue. Moving on to Section 2, Diagnosis and Medical Evidence. Let's talk about the clinical evaluation. As specialists at UT Southwestern point out, diagnosis is usually straightforward. Because urologists see this so frequently, the diagnostic process is actually really simple, discreet, and routine. There are no surprise tests here. It's just a standard clinical evaluation, designed to get you answers quickly so you can start looking at real solutions. This evaluation generally follows 3 standard diagnostic steps. First up, your doctor will take a thorough medical and sexual history just to understand how this is affecting you personally. Second,
They'll conduct a focused physical exam to literally feel for the location and the size of that scar tissue. And third, they'll often utilize medical imaging to get a really precise look at the internal structures.
Which brings us directly to the penile ultrasound. This is a completely painless, state-of-the-art way for doctors to check your blood flow, evaluate the tissue characteristics, and locate the exact size and density of the scar tissue. Having this objective data takes all the guesswork right out of the equation. It helps your doctor tailor a treatment plan specifically for your unique anatomy.
Okay, Section 3, Proven Treatment Options. Let's explore what proven clinical care actually looks like.
Clinical care for this follows a very logical progression. It starts with that comprehensive evaluation we just talked about, then moves into less invasive, non-surgical therapies, and then, only if absolutely necessary, progresses to surgical intervention. The goal is always to use the most effective, least invasive option first to restore function and ultimately improve your quality of life.
For guys with mild to moderate curvature who are having difficulty with intercourse, medication is a major first-line defense. Dr. Stanton Honig of Yale Medicine notes, "I think the fact that we have an FDA-approved drug is really a breakthrough." He's referring to specialized injections, like Xiaflex, which are actually administered directly into the plaque to actively break down that restrictive scar tissue. Another really foundational, non-invasive approach is traction therapy. Interestingly enough, this isn't some new or experimental fad. It's actually a safe, centuries-old medical principle. The concept is beautifully simple. When tissue is subjected to long-term controlled stretching, the body gradually adapts to it, and that restrictive scar tissue can actually begin to straighten out. For men who want to pursue a more natural solution, maybe they want to avoid medication, injections, or surgery altogether, at-home traction therapy is a highly viable option. An excellent clinical example of this is the Penisal device. It allows for controlled, gentle stretching right in the privacy of your own home. It objectively applies that proven principle of traction therapy we just mentioned, helping the tissue gradually adapt and straighten over time. However, for more severe or persistent cases, where the curvature is significantly impacting function, skilled microsurgery remains a highly successful option. Expert urologic surgeons can physically correct the curvature and restore function. While it is obviously a more intensive step, it is a very routine procedure for specialized surgeons, and it offers excellent long-term outcomes for the patients who really need it. Finally, Section 4, Summary and Next Steps. Let's talk about how to take action today. So the absolute crucial takeaways I want you to remember are these. Peyronie's disease is an incredibly common condition. It's merely a physical, structural scar tissue issue, literally just like having curved fingers. And most importantly, it is highly treatable. You do not have to accept the physical pain or the psychological burden as a permanent part of your life. There's hope, for sure. Which leaves us with one final vital question. Are you ready to break the silence? If this explainer resonated with you today, I warmly encourage you to schedule an evaluation with a specialized urologist. Please, don't let stigma hold you back from living a full, healthy life. Check the link in the description to continue your educational journey. Medical science has already solved the hardest part of this equation, right? The only remaining variable is whether you'll take that first step to reclaim your life. So what do you say? Are you ready?